The symptoms of AFib can be noticeable, but for many people, it's not always alarming. Things like fatigue while exercising, shortness of breath, and weakness might be dismissed as just part of aging. And if your heart just skipped a beat, our next guest says it's another sign that you could have AFib. Dr. Percy Morales joins us with the diagnosis and treatment options at Modern Heart and Vascular Institute that could be a lifesaver. Good morning.
Good morning, Deborah. Thanks for having me today.
Yeah, absolutely. You know, it's interesting because AFib has been around, but it seems like recently we're hearing much more about it. So atrial fibrillation, what's happening with the heart that makes it act this way?
So atrial fibrillation is the most common heart rhythm. It's more of an electrical problem of the heart, and it makes the upper chambers of the heart, or the atria, which is where atrial fibrillation comes from, go very rapid and very erratically, and it makes the heart go just from a nice steady heartbeat when you're just sitting under nothing, then all of a sudden it just shoots up and it can start going 150, 180, and just gives that very fast, erratic heartbeat feeling.
So if someone's been checked and says, oh, I don't have heart disease, the test that you do for that might not be the same as this, right?
Yes, exactly, because especially with atrial fibrillation, when it first starts, especially people are not in AFib all the time. It comes and it goes, and sometimes they may get heart tests and say, everything is fine, but then they get these episodes that come and go, and sometimes they can be months apart, and then you have to really catch the episode to really figure out what it is that the person's having.
Yeah, and they don't associate it with the heart. Like chest pain, oftentimes you would associate with the heart, but fatigue, dizziness, shortness of breath, and irregular heartbeat, of course, that one they would recognize something's going on. But as I mentioned earlier, it can be dismissed as something else, right? But there's also risk factors, especially if you have those risk factors get in quicker, right? So what are some of those risk factors?
Yeah, so there's several common risk factors for people to get atrial fibrillation or AFib. Probably the most common one would be age, and as people get older, over 60 years of age, the more people who have AFib are older than 60 years of age. There are some younger people these days that are getting as well, but most common they're over 60 years of age. But there's also other chronic medical conditions that increase risk for getting AFib, such as high blood pressure, diabetes, obesity, having had other heart problems, like if you've had a heart attack before or surgery in the heart in the past, certainly increases the risk for getting AFib as well.
Yeah, so outside of being bothersome, can it be deadly?
Yeah, so it can cause a lot of serious complications. You know, obviously there's that feeling and that uncomfortable feeling that it can give, but as far as the heart goes, if it's not well controlled over time, it can actually weaken the overall function of the heart. But probably the most dangerous thing about atrial fibrillation is risk of stroke. People who have AFib are about 5 times more likely to have a stroke than people who do not have AFib.
Wow. All right, the good news is there are treatment options. What are those? So
there's a variety of treatment options. You know, I always tell patients medications are always an option. Medications to, one, control symptoms, but then also to reduce risk of stroke. And honestly, that is probably one of the most important initial parts of treating atrial fibrillation, is reducing that risk of stroke, which for many people is going to require blood thinning medication, but there's a few different treatment options for reducing risk of stroke as well. But then when it comes to symptoms, there's a variety of other treatment options other than just medications. There's procedures. There's one common procedure called a catheter ablation, where you enter through a vein through a patient's legs, take catheters up to the heart, and make strategic burn marks in the heart where most AFib comes from. In general, that works better than most medications done, especially when you look at long-term control. But then lastly, obviously, lifestyle modifications also play an important role, especially when you look at the long-term treatment of somebody with AFib, whether they get medications, procedures. In the long term, weight loss and controlling your blood pressure are all an essential, important part of treatment as well.
Yeah, a lot of people are asking, okay, so when do I see a cardiologist? And do I have to go to a primary care physician first? With Modern Heart and Vascular Institute, you can go straight to y'all, right?
No, that's exactly true. I mean, you don't have to see your primary care doctor first. If you're having symptoms, concerning symptoms of AFib, you're welcome to make an appointment, come see us directly. And to be honest, like anything, the sooner it's treated, the better the results are going to be. I love it when I meet a patient who is relatively newly diagnosed with atrial fibrillation, because that's when I know I can give the best results and the treatments are going to work the best for them. You know, sometimes I meet patients that say, I've had these symptoms for years and I didn't get it checked out, and one of my first thoughts is like, I wish I would have met you years ago. You know, and so it's really important to get seen and checked out quickly.
Like a lot of times we think we're bothering the doctor, right? No. Don't dismiss it. If you think something's wrong, chances are something's up, or at least know that you can eliminate a more serious issue. All right, Dr. Morales, you have a book, Your Complete Guide to AFib, the essential manual for every patient with atrial fibrillation.
That's right. I published this book because atrial fibrillation is a confusing disease. There's a lot of people have questions about what causes it, what are the treatment options, how can I best apply it in this situation. So I wrote this book. It really is meant as an A to Z guide for anybody who has atrial fibrillation so they can understand a little bit more about their disease and what their treatment options are. It is available on Amazon, but at the same time, I keep it in my office. So when somebody wants that really personalized approach and come and see me at Modern Heart and Vascular, I like to give copies to them so they can better understand the disease as well.
Yeah, all right. Vascular Awareness Month is September. Speaking of understanding things, the heart has got a lot of things going on with it, but if the heart ain't happy, the body ain't happy.
Yes, and ultimately everything is intertwined, even whether we're discussing things like atrial fibrillation or their heart attacks or circulation problems in their legs. It's all intertwined, and people frequently have multiple, when you have heart problems, you frequently have multiple of these things. They all need to be addressed. Sooner the better, and so if anybody wants to make an appointment with Modern Heart and Vascular, we'll address everything and we can prevent things before it really becomes a problem.
Yeah, all right. To book an appointment with a board-certified cardiologist at Modern Heart and Vascular Institute, visit them online at modernheartandvascular.com, modernheartandvascular.com, or give them a call at 832-644-8930. Again, that's 832-644-8930. They accept most major insurance, including Medicare. Appointments do fill up fast, so contact them today. Modern Heart and Vascular Institute has locations throughout the greater Houston area, including their newest location in Tomball. They also have doctors who are fluent in Spanish as well. ¿Se habla español?
Claro que sí, Deborah. Podemos ayudar cualquier problema de su corazón. Haz una cita, por favor.
Oh, mi corazón. Muy guapo, doctor.